a new year with more and more people being immunized against COVID-19, please remember that we are not over this side of the mountain just yet. We still have some kilometers to climb before we can safely go down the other side. So please celebrate this coming new year with all the optimism and hope that it deserves, but do so with great care. This year we need to celebrate with those in our immediate household only, so that next year we can gather and raise a toast with all our family and friends. Thank you very much, and with that I will turn over to the media for questions.
We'll go to the phone lines. Just a reminder, one question, one follow-up. Over to the first question, please.
From Chris Rushery at the Toronto Star. Please go ahead.
Oh, hi, thank you for taking my question. I'm just wondering if you could talk a little bit about why the policy of reserving the second dose of the vaccine changed.
You were a little muffled, but I think you asked about the policy of changing the second dose. So up till now, in the province, we've been taking a precautionary approach and saying, okay, the product monograph says for Pfizer vaccine, you should get the first vaccine, and then you get the second vaccine 21 days later to get optimal protection. So because the supply was not stable, we were holding back the second dose to make sure that whoever got the first dose would get the second dose at the 21-day mark. Now we have information from the federal government that the supply of Pfizer is much more stable and more we can expect it on certain days and certain amounts. So we have informed the hospitals that are involved and the public health units that they should give out more of the first dose so that more people can be protected, and at the same time ensure that people do get their second dose at the right time.
Follow up.
Thank you. General earlier today that it would be great if Health Canada took a look at how Moderna a one dose instead of two dose. Is there any evidence that that could work, that more people could be vaccinated faster in this case?
Authorized by Health Canada, and we're expecting a shipment very soon in Ontario. The information I have is that with one dose, there may be about 80% protection, but we don't know for how long that would last. And the product monograph and the information from the trials that were done by Moderna says that you should have a second dose at 28 days. So I think that's something we'll have to look into further with Health Canada.
Next question.
From Brian Lilly, Toronto Sun.
Dr. Yaffe, you were just mentioning the cases of the new variants and the fact that they've both been in contact with recent travelers. Premier Ford has alluded to data showing that people only spend about 77% of their 2-week quarantine at home. These cases would seem to indicate that people did not quarantine properly. Are you concerned that people are not abiding by it, it's not being enforced, that it is leading to increased community spread? Obviously, there already is community spread.
It's very important that people do quarantine, as I mentioned, when they come back from out of the country for 14 days. And we have been urging the federal government to strengthen the measures they are using to ensure compliance with that. At the end of the day, it still does depend on individuals to comply. And our cases so far in Ontario, the third case, the one in Ottawa, my understanding has been appropriately quarantining, and there has been no evidence of spread, although public health is working with contacts. The other case, the couple in Durham, it appears that there was transmission, and I know that Durham Public Health is working very closely with the family to try and figure out exactly what happened and make sure that there's full compliance. I do think we need to look at how do we identify the variants, and so I might turn it over to Dr. Allen to explain how we're looking for variants in Ontario now.
Thanks very much, Dr. Yaffe. So with respect to the variants, it's very common for there to be mutations in viruses. The unusual thing with the UK variant is that the number of mutations that have occurred is disproportionate to the usual rate of mutations. So there's more changes in this virus than we would normally expect. The main concern really is with respect to the implications of this, and the early modeling data from the UK has suggested that it's more transmissible or more contagious than the previous variants of COVID causing disease. And it's this really that is raising the alarm bells. We already have quite high rates that have been described. And again, reinforcing the importance of all of the measures to prevent transmission that are underway, and asking for the support of the community, the public health community, and the health community to further support this. There have been some preliminary studies looking at other possible consequences of this variant, the UK variant. So specifically, whether it causes more severe disease, and to date, there's no evidence that it causes more severe disease. And then lastly is in the diagnostic and vaccine categories. So the tests that we use in Ontario all detect disease caused by the UK variant. And to date, the early suggestions are that the vaccines that are distributed will be effective against the UK variant. With that, we have in place, and we're further enhancing the systems to perform surveillance of potential variants through what we call genomic surveillance. And this is done through collaboration of all of the laboratories across Ontario, research groups as funded by Ontario Genomics, and a national or a pan-Canadian network to look at these. At Public Health Ontario, we already sequence over 10% of all positive strains that are here, and we share that data to be proactive, and we have been doing that actually since the beginning of the pandemic. To date, we have not seen any community cases of the UK variant, but we need to be vigilant both in terms of detecting that and potentially other variants that may emerge over time. With that, over the holidays, we're instituting increased capacity so that we can perform genomic sequencing in real time for travelers that return should they develop COVID disease, and also look at potential super spreader events and other serious illness so that we have the capacity to identify variants as they emerge early. Again, this cannot be done except with the collaboration across the province and many of the laboratory workers who are working over the holidays that helped us to identify these 3 cases. Thank you.
Follow up?
I'd like to ask specifically about some of the claims that are made, and I'm sure, Dr. Yaffe, you've definitely seen this. You can't make a statement or claim about COVID-19. You can't publish anything about it without being inundated with people that either believe it's a hoax, think that the PCR test doesn't work, that Ontario is just having a bunch of false positives. Can you address some of the more common claims, fake news, pushback, whatever you want to call them, against what you sit out there and say on a regular basis? In particular, and perhaps Dr. Allen can speak to this as well, the claim that Ontario is not experiencing that many positive cases because the PCR test just gives false positives. I've heard everything from 30 to 50 to over 90%. What can you tell us about that?
I'll start and then turn it over to Dr. Allen about the lab test. There certainly are a lot of people who, for whatever reason, don't believe that COVID-19 is actually an infection, that it's causing serious illness, that there's a pandemic. They might have other theories about what's going on. We continue to do education, put information out in various ways, social media, regular media, newspaper, and so on, to try and make sure that the information is out there and as clear as possible with what we know and what we don't know. And, the thing is, if you see pictures of people in the hospital with the deaths, then really it's hard not to believe that we're dealing with a pandemic. I don't really have the best answer for convincing people other than to keep giving them the information that we have, to be as transparent and able to answer questions as much as possible as well, so that they can get the information and understand what's going on as best as we can. With respect to the false positives, I'll turn it over to Dr. Allen.
Thank you very much, Dr. Yaffe. I entirely concur with what Dr. Yaffe said. With respect to false positives, I think there's two parts of that that have been raised as concerns. The first is, are there actual false positives, so people who have never had COVID that would have a positive result? That is exquisitely rare to occur with the laboratory-based test or PCR test. It does happen in very rare instances, and those tests are often repeated to ensure that we get the ideal result. So the sensitivity in that case is over 99%, and the specificity is similarly very, very high. The second question that has been raised is with respect to the possibility of detecting disease when a person is no longer infectious. And that is an area that we continue to learn about. The PCR test can detect disease quite a while after, and in fact, in some cases, many months after the initial episode. And in those instances, the likelihood that those individuals are infectious is very, very low. But the science is still evolving to know what those thresholds are and what the correlation is with the test and the degree of infectiousness. And again, we remain humble to make sure that we both have a very good diagnostic test, but we continue to learn more about what that means with respect to people being able to give the disease to others.
Next question.
Beth McDonnell at CTV News. Please go ahead.
Hi, can you hear me? Hi, can you hear me?
Yes.
Yes, we can hear you.
Hi. These holidays, we're all being told to limit our outings to essential ones only. What do you make of Finance Minister Rod Phillips taking a planned vacation out of the country on December 13th and being away, he has still not returned today? Well, what message does this send? What do you make of this from your medical perspective?
Well, I can't really comment on what the minister's done or not done, but obviously the public health advice has been and continues to be not to travel outside of the country unless it's absolutely essential. And if you do travel, when you return, it's very important to go into quarantine for 14 days. And if you develop symptoms, to call public health and get tested.
Follow up.
And we've been told the minister
will be quarantining. What message does it send to the people of this province when one of our leaders, is taking a vacation?
Obviously, I would prefer that people don't take a vacation at this time unless it's an essential reason to travel. And that's the message we keep telling people.
Next question.
Next question will be from Stephanie Marotta, Globe and Mail. Please go ahead.
Hi, thank you for taking my question. So as the province plans to ramp up vaccinations, when it comes to staffing and resourcing, both in delivering the vaccine at clinics and ensuring that frontline workers aren't off at the same time due to potential side effects, what will be done to address those pressures? And in the long run, what is the bigger concern with vaccinations? Is it supply or is it staffing?
You were a little muffled. I'll try and answer as I understood it. What's the bigger pressure, the vaccine supply or the human resources? Up till now, we have been concerned about the stability of the supply for Pfizer, and now we're pretty confident with information from the federal government that the supply is relatively stable for the next while. And with Moderna, it's just starting, and we'll see how that goes. So the first pilot has been in hospitals because with Pfizer, as you know, it has to be stored at minus 80 degrees. And that's not something that can be done in multiple places across the province. However, now that we're moving in next week to Moderna, public health units will be taking over the lead in planning and coordinating the implementation of the vaccination across the province, starting with long-term care facilities and high-risk retirement homes. And they would be working in collaboration with the homes, with paramedics, with physicians, with community health centers, with a variety of stakeholders to implement it. So I think human resources are obviously an important element, but should not be a limiting factor.
Follow-up?
Yeah, I'll repeat the first half of that question because I think I might have gotten cut off. So the first part of it was, in terms of staffing and resourcing, what will be done to address the pressures that hospitals and centers will be facing in terms of having enough staff to provide the vaccinations, and as well as ensure that frontline workers aren't off work at the same time due to potential side effects. And then my follow-up question was on the Moderna vaccine. Knowing that it will be piloted at a handful of LTCs, do we know which long-term care homes will be receiving the Moderna vaccine first?
I'll answer the parts I understood. If I missed something, you can ask again. With respect to side effects, certainly people are informed when before they get the vaccine. They have to consent and they have to understand what the side effects can be. And some of the side effects can be similar to the symptoms of COVID-19. So we recommend, if possible, that they are not scheduled to work for the following 2 or 3 days so that they can get over whatever the side effects are of the vaccine if they have them. So that's something we try to work with the facilities on schedule to make it, if it's possible, to schedule the staff that way. We don't know yet which long-term care facilities will be done next week or earlier if possible. The public health units, I believe we're starting in Toronto, York, Peel, and Windsor, are identifying a small number of long-term care facilities working collaboratively with the facilities, Ontario Health, and the Ministry of Long-Term Care.
Last question, unless anyone else joins.
Will be from David Thurton of CBC News. Please go ahead, David.
Hi, thanks for taking our questions. I joined a bit late, so can you just clarify for us what the province is asking the federal government to do when it comes to the Moderna vaccine? Retired General Rich Hillier seemed to suggest that he wanted the permission to just use one dose of the Moderna vaccine. So can you just clarify, is that a provincial policy? Is that a provincial request that y'all are making?
I have to admit, I did not hear the General's press conference. I've been told indirectly that this is what he mentioned. I think that, we continue to work closely with the federal government, and my understanding at this point, the product monograph says you should get 2 doses 28 days apart to get maximal efficacy. There is pretty good efficacy after the first dose, but we don't know how long it lasts. So I'll have to follow up to see exactly what we're going to be doing, but my understanding at this moment is we'll continue with the product monograph.
Follow-up, and this is the last question.
Yes. Can you tell us whether or not any residents in long-term care, or how many residents in long-term care, have received the Pfizer-BioNTech vaccine or their first dose of that?
So far, my understanding is no residents in long-term care have received it. We've been focused on the people who work in long-term care and their essential caregivers.
Thanks, everyone.